Hello again, everyone. Dave Benson here with the Center for Personal Protection and Safety. I want to have a continuing conversation from my previous video when I discussed how important a comprehensive workplace violence prevention intervention program is for healthcare, and as a critical component of that, a threat management team concept in assessing and intervening in potential threats. Workplace violence in healthcare is a complicated issue, I think, as many of us know, and the situation continues to worsen. For example, between 2013 and 2017, there was a 10% increase in the number of injuries in healthcare and social services workplaces, all stemming from violence of some sort. And in fact, the 59% increase in facilities directly related to workplace violence in the healthcare sector within that same time frame. You know, I think it's essential that organizations take it upon themselves to identify and implement viable evidence-based solutions to manage this trend, and certainly behavioral threat assessment and multidisciplinary threat management teams and programs fit the bill in that regard. Threat assessment is a recommended tool for healthcare by the Office of Quality and Patient Safety with the Joint Commission. And as I mentioned in my last video, they recently strengthened this recommendation in January of 2022. While threat assessment is not applicable to all different types of violence, such as reactive or unintended, as you can often see in the emergency department, there are several other situations in healthcare where threat assessment may prove to be a valuable tool as part of a comprehensive violence prevention program. These situations include stated or implied threats from patients, families, violence with visits, admission, intimate partner situations, and outside threats in general. So, and let's not forget the potential for terminated or disgruntled staff members. Significant results that have been achieved in the field of education and in the public and the private sector with threat assessment is really directly applicable to the healthcare industry. Myself personally and the Center for Personal Protection and Safety have been involved for quite some time now in consulting and working with various healthcare organizations and systems and implementing these programs. So when it's time to create a team, is that any different than any other type of multidisciplinary threat management team? Well, I think the short answer is no, but you want to be, as you always do, organizationally discipline specific as to who comes to the table, because you want that team to represent the needs, the mission, the demographics of the healthcare system. So, as I've stated, it must be multidisciplinary to be effective, in my view, so you can communicate across all relevant departments in the organization, and it should include at a minimum representatives from security or loss prevention, human resources, legal, risk management, as well as frontline supervisors from areas with the highest risk, and let's not forget mental health professionals. In addition, internal team members must consider groups like labor union representatives and other outside agencies, perhaps even contractors that work on a daily basis, because we want to have everybody on the same page. You may not bring everybody together for every incident, but you want to be able to go to the well and have the resources you need to effectively conduct that threat assessment, threat management protocol. Some of the most extensive external members would be law enforcement, other healthcare organizations, and last but not least, a threat assessment professional such as a certified threat manager are all very important tools that can be and should be included, in my view, in this multidisciplinary program. So, threat assessment should absolutely be considered a critical component of a comprehensive workplace violence prevention intervention program in the healthcare realm. It has in fact proved very effective for managing threats in a healthcare setting. We don't have time today to be specific, but I've been personally involved in many good news stories, or at least effective mitigation of potential dangerous situations. Furthermore, the multidisciplinary approach encourages information sharing. Knowledge is power, and if you remember from our discussions in the past of what are some of the key components of a workplace violence prevention and intervention program, it's communication. It's an information-driven system. If you don't get the information, you're not aware of potential concerns, you can't get involved and try to either avoid or mitigate or respond to a potentially volatile situation. It also covers when and how often would you involve law enforcement. That's why there should be key external partners or another mental health professional with a certain expertise. It also serves to foster an environment of support for employees in very difficult situations, which may actually lead to increased reporting of potentially concerning or dangerous behavior. Finally, while threat assessment is really prevalent in other industries, especially education and the public sector, the private sector, it hasn't been as far-reaching as I would personally like in the healthcare industry. But that's beginning to change. And I want to tell you that that process, the threat assessment process, can be fairly easily adapted to benefit healthcare organizations specifically. In fact, CPPS has developed a healthcare-specific suite of training and consultation offerings for healthcare organizations. So if you have more interest in that, please reach out to us and we'll answer any questions that you might have. Well, I hope you found this useful. Suffice it to say, I'm a strong advocate of behavioral threat assessment and management in a healthcare setting, and I'll talk to you next time.